Hello, welcome to another episode of Your Health Matters OC. This is Dr. Clayton Chow with my co-host, Dr. CK. Say hello, CK.
Hello, good evening.
Today we have a very exciting topic for you. Continuation, you see some of our returning guests on the topic of food and as health, as well as food insecurity. And then we also have two extra special guests. But before I go to them, let's start with CK giving us an update on the COVID condition.
Yes, so thank you. The good news is that our numbers are improving with COVID. Our case rates have reduced to 4.4 per 100,000, and our average, our 7-day average has also been decreasing, and our case positivity rate is now at 6.2%. Our hospitalizations has also improved with 147 folks requiring hospitalization for COVID and the 21 ICU admissions. And again, in terms of our hospitalizations, those who are hospitalized are more commonly those who are not fully vaccinated. So it's really important for everybody to still make an effort to get the most updated COVID vaccines because they can help protect against severe illness. Just want to also mention that with CDPH updated isolation and quarantine guidance, there has been an update to align with CDC. So if you are COVID positive, you actually have COVID infection, the recommendation right now is to stay home and isolate for 5 days. As long as your symptoms are improving and you're fever-free for over 24 hours, you can actually get out of isolation without testing. Of course, we do know that people still can remain positive beyond 5 days. So if you're around someone who is very vulnerable, you may want to consider testing, but realizing that the state of emergency has now ended for the state of California and realizing that access to testing may still be an issue for folks, a test is no longer required. It is still recommended that if you have COVID infection and you're outside of isolation, that you also continue to mask for a 10-day period. Those who have severe illness or chronic conditions may need to isolate longer, and this is where it's important to remain in communication with your primary care team or your provider. Further information can be obtained from cdc.gov, coronavirus, or our ochealthinfo.com. Additionally, we will be updating our health officer orders, so please take a look at our website. Hopefully it'll update in the very near future this week to show you the guidance currently that will be in effect here locally.
So in other words, the California COVID emergency order has ended on February 28th, and the federal emergency order will end, as far as we know, on May 11th.
Correct.
Right? And so with that in mind, the guidance is very simple in my mind, right? If you're eligible for the vaccine,
right,
go get vaccinated to be updated, especially those of you who are high risk, meaning you have chronic health conditions or you are senior, whatever way of describing that, or you living with loved ones who fall into the high-risk category, right?
Correct.
So get tested if you have symptoms, and if you truly tested positive for COVID, you need to stay home for 5 days, right? You don't need to test out, but if you leave the house after 5 days, please be mindful and wear a mask for another additional 5 days for a total of 10 days.
Correct. And also, if you have high risk for severe illness and you do get COVID, please get treatment.
That's another piece is treatment is readily available. You can even get it at a pharmacy.
Correct.
Right? You don't need a doctor prescriptions to get treatment for COVID as an outpatient. So you can either call your primary care physician or you can go to your local pharmacy and request what they call test to treat.
Correct.
Right? So as Dr. CK said, she's going to update the health officer order because there are certain requirements that as an employer businesses will still need to follow, and that's part of the occupational safety and health hazard that employers are bound to require to follow. Okay?
Right, and it's also in an effort to reduce transmission because we know that we're still dealing with variants that will continue to affect us, and we have to get to a level of understanding what our personal responsibility is and not requiring specific mandates and to be in place. I think it's been 3 years. We've learned a lot in the 3 years, and hopefully people know now that if you're sick, please stay at home, get tested, and seek treatment.
Right. We have to follow those simple steps because we're going to have to live with this virus for, gosh know how long, right?
Right.
As far as we know, the next couple years is going to be very important as people incorporate these kind of measurements into our daily living, and so that we can go about our life.
Yeah,
so
and as you can see, I don't have my mask on. I usually do have my mask on, but we're in a very large open space, so I feel more comfortable, but guaranteed you'll probably still see me out in the public with my mask on because I do consider myself a higher risk individual, so I'm using my own personal precautions to protect myself and my family.
And I do too. I mean, people ask me, well, how come you still wear a mask? As you probably know, I used to care for my elderly mother who since passed away, who was very high risk, but I work with somebody who was high risk. We see each other more than 15 minutes a day because of the work that we do. So I need to take care of myself and protect myself to protect her.
Thank you.
Simple as that. Okay. Well, let's get to the topic tonight. For those of you who did not have a chance to view our video on food as health, I would recommend you to go back on YouTube and search for that episode and watch it. That episode was very important, and we really found out the issue of food insecurity and how people can access food in this county, the richest county in the richest state of the richest country in the world, and we still have people who have food insecurity. Returning guest from that episode is Mr. Antoine, is the director for Orange County Social Service Agency, and Miss Claudia Keller, who is the Claudia, you're part of the OC Hunger Alliance, but you're actually the CEO of Second Harvest.
Yes, that's
correct. Did I say that right?
You did.
And then we have two new interesting, I'm going to say interesting, because what I found out on what they do, I already cried before we start the show, so get ready. We have Mr. Joe Perez from the City of Anaheim. Joe, you are the Human and Neighborhood Services Manager.
That's correct.
And then we have Mr. Lambert Lowe, who is the Compassion Analyst, among other stuff that very interesting and find out about you. But you are the co-founder and who's responsible for this space where we at today, right? This is the choice market within the dwelling place here in Anaheim.
Yes.
And we're gonna get detail into that. But let's go right in. If you want to share, you have a fascinating personal history. I mean, one of the things that when I first got to know that I'm going to talk to you, I Google you and all kind of fascinating things that you've done in your life professionally. You are pretty well known, but tell us about this space first. You're responsible for this space. Tell us about this space.
Yeah, this space was it's really a dream come true. Like you said, we saw COVID change many things around us. Everything was changing around us, and what we found out that it changed our hearts the most. And that time we had to make some decisions. We were in the food distribution space for a number of years, and during COVID, we saw the need rise, and we saw partners come together from the city, from Second Harvest, Samueli, but the need was rising and rising, and we were just giving out food. And it was important that we did. We met the need. We almost 10 million meals during COVID time. But at the end of the day, what changed for us was not giving out a lot of meals. We wanted to see families move out of poverty, really. So we weren't satisfied with just giving out a lot of good food. We created this space where families would now come. It wouldn't be a transactional food pantry. It would be relational. And the thousands that come every week have an opportunity to share their story. We get to hear some of the things that are happening deeper down, more than just food. and address those issues. When you come into this space, it's unlike any pantry. You don't expect, when you walk in here, you don't expect to see this, you don't expect to feel this, see this, smell this, and later on taste this. So hope is a big value for us. Dignity is a big value for us. So we created a space where we remove the stigmatism of going to a pantry. Sometimes you feel like the shame of it and the stigma of it. And removing that has been such a gift for so many of the families that come through this space now. So what you see here is a choice market. There's nothing like being able to go and shop for your family. And that's important for us and for a lot of our guests that come through this space. Is we don't get told, here's what you need. We get empowered to choose what we love for our families.
So is a version of the supermarket that everyone in the community go to every day or once a week to get your food, but it's free. Who qualify to come into this space?
Exactly. Everything's online, and you go through a little assessments. Low-income families will qualify. We're partnering with the city of Anaheim. They've identified pockets of families who also qualify, need to come to use food pantry services. Our distribution, it just looks a little bit different. You're going to not only find good food, but you're going to find so many more things that you didn't expect here. So that's what we're dishing out the most is, I think, more than food, but hope and dignity.
Mr. Perez, why did the city choose? I mean, I'm sure there are other food pantries and there's other churches that give out food, grocery, to the resident here in the city. Why did you choose to work with the Choice Market?
Sure. So our relationship with Dwelling Place goes back to 2020. As we're all aware, March 13th of 2020, the city and the world shut down. And in short order, my responsibilities of our community centers, family resource centers, and youth centers, with those closed, we turned those into distribution centers for the highest priority, which was food, and the second priority, which was emergency assistance. And so by doing that, we partnered with Second Harvest Food Bank and some of the others that you just mentioned, churches and others. But Dwelling Place stepped up, Lambert specifically. I say it, they were literal godsend, because the number of seniors and the number of families that we were serving, the city could not do it all. We can do a lot, but we could not do it all. And so it was a relationship that, Lambert and his team coming to us and saying, what can we do to help? And so in short order, we were providing distribution of food commodity through our family resource centers, youth centers, community centers, any outlet that we could find, and doing it in a safe space. But there were seniors that had stay-at-home orders. Yeah. And Dwelling and folks that volunteer here stepped up and said, we can take that portion of your responsibility and provide food out to our homebound seniors that were not allowed to come out. It wasn't safe for them to come out. And so, we activated a call center. We already had a core group of seniors that we were serving, but we activated a call center for any seniors that were needing assistance, that we put together a list, connected with Dwelling, and they basically home delivered meals to seniors on a weekly basis. And so that's where our partnership started. And as the months went on and the years went on, we thought we'd be out of the food business. We were doing probably 10% food distribution pre-pandemic, but certainly, as you just mentioned at the top of the segment, food insecurity is high amongst Anaheim residents. And so we are still doing this. We were having a conversation with the Samwali Foundation through some other work, grant work that we were doing with them. And when they came to us and asked us, what are the needs and how can we help? It was really sharing this partnership that we had already established. And I think the vision for this space had already been set going. It was going, and it was like, hey, well, let's partner. Samwali had a funding that they put forward. And basically we set up an opportunity to help Lambert establish, purchasing the food and establish this site. And then we connected the residents that we serve through our family resource centers, community centers, and youth centers to come here once a week. And so, it has been, again, a little godsend, this relationship with Dwelling Place, because as I mentioned, the city does a lot. We have a big responsibility, but certainly we rely on our partners to be able to help us fully provide a full level of service to our youth, families, and seniors.
So I earlier was just talking to you all, and I mentioned that I've seen food pantry and certainly have been the recipient of food pantry in churches when my family first came to this country as refugee, and we were very grateful. Don't get me wrong, but most of the time we take a bag of grocery home and we look at each other, look at the stuff in the bag, and said, "What do we do with this?" Right? And certainly during the pandemic, we talk about those seniors who have chronic health conditions, and if an entity, whatever, whether it be a group of people who will, out of the goodness of their heart, give out food, or a church, or a food pantry, you give out what you have, right? And the person, especially the elderly with chronic health condition, some of the food might not be appropriate for them, right? Sodium content, sugar content, what have you. From a primary care physician, right, what do you use to tell family that have food insecurity and receiving food donation or gift from an entity like this?
It's a hard discussion, right? Because usually the foods that are donated are not the most nutritious, and they don't usually have options. And unfortunately, people who are lower income, or even when I served the homeless back in my undergrad days, what we learned is that they're higher risk for diabetes. And so then you're giving them high load carbohydrates for a very short period of time, so you can actually exacerbate their diabetes. And so then you have to try to focus then on what else can I do about vegetables, or trying to get more vegetables in to get that fiber in and reduce the sugar load. It's hard. It's hard when you're so limited, and you just have to just take what you can get. And I'm really grateful that you have the variety of options here, because again, most people who are not so well off and are really struggling don't have those options. And unfortunately, their conditions can continue to worsen.
Claudia, CEO of one of the largest food bank in Southern California, tell us a little about the decision to support certain food pantries, and actually not even decision to support, but the collaboration, right?
Sure.
How do you make that kind of decision and yet be mindful of the cultural competency piece of it in serving our diverse, vulnerable population?
It's the doctor's quite right. In providing emergency food to the community, you have to be mindful of who you're serving, what their risk factors are. I'm very proud to say that Second Harvest, in this last month, 30% of the food that we distributed was fresh produce, 20% was lean protein, and 10% was dairy. So we're making an effort to put that food out into the community. However, we could not do that without pantries like the one that we're sitting in. The commitment that Lambert has made to use the choice model, which allows families to choose their food, like we all do when we go to the market. We take it for granted, right?
Right.
When you're, as you mentioned, Dr. Chow, when you're handed a bag of or a box of food, you're thankful for it, but may not know what to do with some of the ingredients. And during COVID, the boxed method of distributing food became even more prolific because of safe interactions with folks that were giving out the food. Today, we really look for pantries to lead like Lambert has and implement this choice model where they can. And we realize it's a big lift. And we tell them, start small. Start with a couple of fixtures and a refrigerator, but make the effort to give families that choice. We look to the future to be able to provide more culturally sensitive food. When you're a large food bank, as you say, it is difficult to feed many. Right now, we're feeding on average 400,000 people.
Wow.
Right? So dialing in and getting those fruits and vegetables right is something that we strive for, and we will look to our pantries to tell us what they need and what we need to source. So we're not quite there yet in terms of every community, but it is certainly our intention to keep striving to make sure that every community in Orange County has the healthy, nutritious food that they need and that they get it in a dignified manner.
Yeah. And so, but the number that you gave is astounding to me, right? For one of the richest county in
the wealthiest state
there we go.
In the richest country in the history of mankind, right. And we have on average 400,000 people here that are food insecure.
Wow. What do you see in terms of people who are coming for the food here in terms of their health condition? Is that something you assess? And then I'm going to get on ready in your assessment for people who qualify in this whole business of qualification that's coming, right?
Yeah, for families who come here for the very first time, their initial reaction is, they're in shock because they weren't expecting this. They were expecting to come and receive food, but it is a very holistic approach because it's story-based. We know your family size, we know your employment needs, education needs, health and wellness. All those things are available here. And so we get the holistic picture of a family's journey, and we get to track it with them over the next months and years, and hopefully not years, but years. And we get to see what that journey looks like. Because we get to offer on-site partners in medical and dental, right here, employment. So those education, employment, health and wellness with partners, with the county right here.
So this is not just, I come here for food, that through an application qualifying by the city, but I also come here for other services.
Absolutely, and now we're finding people come here just to say hi.
Wow.
Because they feel like they belong somewhere. They found a friend. Or one of our volunteers' roles when they come in here is to say everyone's name. So a guest that comes through our pantry, they hear their name maybe 7 to 8 times before they go home. You won't find that at Trader Joe's. So sometimes they just come in and they say, hey, it was my birthday today, or hey, how was your birthday? It's becoming like a family. So okay. Yes, they'll get food.
This is fascinating. For those of you who are watching and you have a question for us, please send us an email to yourhealthmatters@ochca.com. The email for you to send us question is yourhealthmatters@ochca.com. So last time we were talking about the food insecurity and the state program, Cow Fresh, and you talking about the redeterminations. Where are we at now, Mr. Tran?
So last time we talked about the ending of the emergency allotment.
Yeah.
So what happened was, as part of the Consolidated Appropriation Act, Congress delimited the emergency allotment that people were getting additional food benefits during COVID. And that was effective last month, the end of last month, February 28th.
Okay.
Since it's paid in arrears, people will still get the February allotment sometime in the last week of March. So next week will be the last time that they will receive the higher level of benefits that they are entitled to. Thereafter, families will then go back to receiving what their normal allotment is. And what we know is within Orange County, that means that there will be a reduction of about $30 million in food benefits a month. So that's a dramatic increase that we are going to see, and people are going to continue to struggle, especially with high inflation, in being able to put food on the table and meeting the needs for their families.
Has that hit where you at yet, Claudia?
We started to see a rise in October and November. We started to approach 380,000 people. We hit 400,000 and then took a bit of a dip in December. January, February, and March, we have seen it steadily go back up. So we are starting to see it in our pantry system.
Mr. Perez, have you seen people now requesting more?
As well, yes, absolutely. Slowly, and we're well aware of the dates that have been posted and have noticed an increase. I think on average, each of our sites is serving close to 300 people on a weekly basis. And we're talking 7 distribution locations that the city is currently offering. And so we're definitely are feeling and will be feeling the effect, obviously, of the reduced benefit. And so more the reason why this partnership is so important, and to the point where, the fresh produce, people are very appreciative of the shelf-stable food that is provided to them. But there came a point in time when, they were ready for fresh produce. And I think the timeliness of this space just was perfect, because it really addressed that need that we were hearing from our seniors, but then from our families as well, of wanting fresh produce, a year into the restrictions and the pandemic. And so again, it's just been a fabulous partnership to be able to offer that, and address the needs that we're hearing directly. They're very appreciative of the shelf stable, but again, the fresh produce is that next level to be able to help address some of the health issues and concerns that our families have and seniors have.
And obviously, Lambert, to operate all-inclusive services beside this space is very expensive, right? I can't even imagine how do you provide the social services, the job, the job development, the training, the medical piece of it. But this space alone, this is treating people with dignity and caring for people with dignity. It doesn't come cheap, let me put it that way. So for us to be able to replicate this, right? Startup cost is startup cost, but ongoing maintaining this level of customer service,
yes,
really.
Yeah.
What you described, I don't think we get from your average supermarket out there. You know what I'm talking about. Some supermarket customer service really, really bad, right? So how do you do this and keep that level of dignity going? Combination of staff, volunteer, tell us.
Yes. It takes great partners like the city, like Second Harvest Samueli. Like Joe said, we can do many things, but we can't do everything. So when we link arms together, it accelerates and multiplies, and it ensures that we can carry a heavier load together. We have an amazing volunteer base here. Our church has been in the food industry, not industry, but services for over 40 years. So this is something that we committed to as part of our mission. We love to do it. To serve it with high dignity, for us it was a big heart and mind shift, that we wanted to see the story of food insecurity change, and unless you know the story, you will never change the story. So bringing it in relationally with the guests changed everything for us. It changed everything for the guests, and we're hoping for the future. My dream is not to open pantries. My dream is to close pantries.
Right.
And gatherings like this, collaborating with partners like this, one day we will get to gather again on this show and say, we closed another pantry. Right. That's the dream.
Right. And that is, the last time we were on the show together, we talked about the Hunger Alliance. Remind our audience again, what is the Hunger Alliance, and how does the Hunger Alliance see this sort of model in Orange County, and perhaps outside of Orange County?
Sure. The Orange County Hunger Alliance is the county's 2 food banks, Second Harvest and the Orange County Food Bank, as well as Abound Food Care, which is the large nonprofit that their mission is to reduce food waste and encourage food recovery. We've come together really to look at the emergency food system and really put a stake in the sand saying, our lane is food. We do food well. But we know that food alone is not going to lift people out of poverty. That we really need to provide a foundation for other nonprofits to do those things, the wraparound services that happen here and at the City of Anaheim. Those are the things that lift people out of poverty. So that is our message, that we can help shore up the emergency food system and look at things like more produce and a better use of the dollar, and promote places like this that promote choice. But really, it's about ending poverty. Hunger is just a symptom of poverty, and that's a big, big part of our message.
So, Mr. SSA director, obviously, you know, the more people in Orange County getting poorer, the more infrastructure you're going to have to build to support folks, right? So hearing what Claudia said, what is your involvement with the Hunger Alliance?
Yeah, I'm glad we're having this conversation, because what you're hearing from everyone is that we need to do things differently. We need to think differently. I think for decades and for a long, long time, we're all doing good. We're all trying to do things, but we're doing it alone. And I think Lambert said eloquently, in which when we look at things holistically, and we each kind of put in a little bit of the resources and shoulder a little bit of the burden, we're able to move the needle a little bit more than what we otherwise have. And the important thing of us kind of coming together is we all recognize the role that we play within the lives of the individuals we're trying to serve, right? It's a community effort. It's not me just providing public assistance. It's not Claudia just providing food, but we're here because we're committed to ending poverty. We're here and committed in changing lives and making a difference within the community. Yeah. So having said that, we did see a dramatic increase in the public assistance budget, or at least the public assistance roles during COVID. And as we're transitioning out, we know that that's going to put a lot of pressure on the communities and the families. You've heard me say about the $30 million reduction in food benefits, but also other factors that help keep the family whole and well includes Medi-Cal benefits, right? That with the public health emergency unwinding, there is going to be individuals that will be impacted as they are forced to go back into complying with certain regulatory requirements that were waived during COVID. So we've been working with the Hunger Alliance to kind of address a little bit more holistically on how we want to approach food insecurity, as well as approaching the topic of how we could unify and work together, partner with other entities like Cal Optima, faith-based organizations, cities, right? Many other CBOs that may not exist within the food space, so that we're able to help solve a common problem and wrap around the services for the family, so that they're not just getting this little bit from me, they're not just getting a little bit from Claudia, but together we're kind of solving a little bit of the puzzle together.
Yeah. I like to say it's the difference between feeding people and nourishing a community. Right. Those extra services really make the difference.
Right. And I'm fascinated that we got county agency director, we got city manager who is responsible for the well-being of the neighborhood, of the community within your city. We got a huge food bank, right? And then we got a food pantry that giving choices, sitting at the same table. Who else need to be in this table? But think about it. Think about that question. What I'm getting ready to do is show folks a video of thinking outside the box. And one of the concept that you talked last time on the show is the farm to food, right? Mm-hmm. So we got a 2 minutes or so video on farm to food. Let's take a look, and then we'll continue with that conversation.
Howdy. Name's Walter, and this is my story. Easy, does it? I was born and raised on this here 45-acre farm in sunny Irvine, California. Can't complain. Never wanted for a watchful eye or a caring hand. I've been soaking up the sunny rays and filling myself with the rich soil's nutrients. All in all, it's been a quiet upbringing. But guess what? Today is my graduation day. That's right. I'm leaving this here field and fixing to make my mark. Packed with that juicy red flesh that makes our kind a summer favorite, I'm what you might call top-of-the-line produce. Through a distribution network that'll put the old Pony Express to shame, I'll be heading to one of 300 pantries and partners in Second Harvest Food Bank's network. You know, they say back in the day, food banks seldom had a fresh item on their shelves. Now, if you ask me, that just ain't right. Especially when we have the ability to fill every hungry mouth there is. Mama always said my time would come to make a difference. Well, I figure I got what it takes to bring a smile to a stranger's face. That's why I'm proud to be a watermelon from Harvest Solutions Farm and do everything in my power to ensure nutritional and food security, one delicious bite at a time. Way I see it, good eating shouldn't be hard to come by.
Welcome back to Your Health Matters OC. Tonight we continue our conversation on food as health and food insecurity here in Orange County. If you have a question for us, please send us an email to yourhealthmatters@ochca.com. You know that very last scene, Claudia? Get me. Mm-hmm. This is the third time I watched this, and it just tugged at your heart, right? I mean, I can't describe it. I don't know why it touched me so. Sorry. Talk to us about farm to food.
Sure. Most people are surprised that we have a 40-acre farm here in Irvine. They always ask me, how did you get that land in Orange County? Well, we work with the University of California, and we farm 40 acres. And 2 weeks ago, we crossed the 3 million pound mark of produce grown in this county for the people of this county for their health. We grow things like cauliflower, cabbage, broccoli, peppers, watermelon, broccolini, and a few green beans. And literally it goes from the field to our distribution center, which is about a mile away, and it's on somebody's table within 2 days. That is the future of food banking. That will make a difference. That will change lives. So we're proud to be doing it here with a little bit of support from the USDA to prove the concept. And some of that produce comes to this market on a regular basis, so we're thrilled.
So not only these folks at the table, but you including the educational side, right? I assume you meant UCI.
Oh, we're
campus,
at UCI.
Right.
We have a college pantry in 14 of the 16 institutions of higher learning in this county.
Right, but the farm, the space that you talk about.
Oh, the space, yes.
That belongs to
That belongs
the
to the University of California, and we rent that space for them. I'm not going to tell you how much we pay because they'd kill me.
Yeah.
But we do have students come through from elementary to college.
Yeah. But if they're listening, they'll give you a discount for the renting. Right. So
but we need volunteers. So if you want to come out to a real farm in your community, we need volunteers.
So there's a question. I guess this question would be for Lambert and for Claudia. This question is from Anne. How can schools and students that want to participate in food drives to help those in need get connected to the two of you? So first, Lambert, how could school get connected to you?
Yeah, that's a great question. It takes about 50 volunteers to make every pantry run because of the customer service involved in it. So you can go online at dwellingplaceanaheim.com and click on the food bank button and it'll get to us. But I would say sign up with Second Harvest Food Bank. They are our heroes, so we send everyone to them. So Second Harvest Food Bank is the first stop you should go.
And if you want to get involved in food insecurity, you can volunteer in our distribution center as a student. You can volunteer at the farm, as I just said. And if students want to do a food drive, they can. They can reach us at www.feedoc.org, and we'll connect a school with a nearby pantry and make sure they get the food and the labor of love gets to the people it's there to help. So
you and I talked about this before the show, Claudia, is that we know there are many churches or faith-based entity, let me put it that way, because it's not only churches but temples also do that, right? And synagogues. So there are many faith-based entities in Orange County who are doing this in silos. And there's many other non-faith-based pantries in this county doing this every day in silos. And I'm thinking of the administrative efficiency for all the individual entity collectively could support a collective, you know me, I'm all about collective impact, right? That if all these entities come together and replicate entity like this with the support of cities. I haven't asked you yet on whether or not you have other city call you and said, hey, how do you do this, right? What would that be? What would that look like? And what kind of effort do we need to drive that kind of collective impact model?
We talk about this a lot at the Orange County Hunger Alliance. Okay. So that can look like coordinating things like logistics.
Okay.
You know, Mark Lowry at the Orange County Food Bank and I always say that our trucks pass on the freeway half empty. right?
Okay.
So that coordination of logistics is one way. Another way is coordination of purchasing. I often joke that every pantry, every food bank, every nonprofit buys toilet paper, but we all buy it separately. Imagine if we could come together and share and pool our buying power, right? So that's another way that we're trying to figure out how do we start to model that.
Right.
And I think the third way is really the standards. What is the standard? If every pantry, and it is a large ask, has the standards that this place has here at Dwelling Place, it would be much easier to have a uniform network with uniform standards and expectations, whether they're faith-based or schools or what have you. So it's really aligning the expectations of the emergency food system, and we're starting to have those discussions with our partners and partners like the Samueli Foundation in the county. It's starting to happen because we realize the art of the possible.
So I used to work for hospital system here in Orange County, and I know all nonprofit hospital system has an arm of profit, community benefit programs, right? So I know every hospital system is trying to address the issue of health insecurities, especially for patients. We both came from the Provident Health System, and I know the physician in the Provident Health System pay attention to the needs of those patients who have chronic health condition that your ordinary, typical food pantry would not be able to support their health meals and what have you, right? And I am sure those physicians could drive the community benefit and said, let's put effort, but let's not do it alone. Right. Let's do it in partnership with other health systems. Right. Has that come across your conversation, Claudia? I didn't mean to put you on the spot or put my colleagues from health system on the spot, but I'm doing it right now.
Yeah, I think the hospitals are supportive of our mission.
Okay.
Maybe not always in a coordinated fashion. We see what's happening with mental health and Be Well. Yeah. That's a wonderful example of the system, private or profit and nonprofit, and cities and private business coming together. I think also we can look at the CalAIM and the medically tailored food boxes, and that's how that's starting to take off. So I think food as medicine is really starting to find chops within the healthcare system, and we're here to support it however we can partner with entities like hospitals. Yeah.
So other city, you must have gotten calls from other cities.
Yeah. So no, we've certainly have had conversations with other, and everybody obviously is doing what they can do to be able to answer the call for their residents. This program specifically, it's a relatively new program that we launched just a couple months back, and so we're still learning in terms of the registrations and the cases, because we also do an intake when we receive a phone call from a senior or from a family that are interested in participating. It's not just sign you up and give you an appointment. It's come and meet with us and let's find out a little bit about your history, what other services we can provide. So it's not just the nutrition, it's what other social service support can we provide as part of our Family Resource Center system to be able to help you, stabilize your home environment. And so, there's been interest. Certainly, there's been interest from other cities. I think, within the next couple of months, we will have a really good story to tell. I think just with the success that we're seeing so far in the few weeks that we've opened and are operating, and so very much looking forward to sharing the story because, it is possible. A city and faith-based organization with foundation support and others just chipping in, it's possible to make things work, to be able to help communities. And again, it's one household, one neighborhood, one community at a time, one city at a time to be able to address this ever-pressing need, because we're still rewriting the story. We're rewriting the new normal for us coming out of COVID, and what was a priority pre-COVID has now changed. And that's where we're still working out that story and addressing the needs where we can.
So Lambert, you talk about there's medical services here. Tell us a bit about that. What is the protocol? What is the flow from someone who come in for food and then tie into the medical services?
Because it's story based, and we hear your story, and so much happens in this little room over here where a guest sits down with one of our trained volunteers, and they just go through their journey, and they start sharing of different needs. A lot of it is medical for either themselves or their children. And we can set up appointments in the future. On site, we'll have the county will come through. We'll also we partner with families together, and they'll bring their mobile dental, their mobile hospitals right here on site. We also partner with Biola University. They're here every pantry to do assessments on high blood pressure and just talk through medical next steps for anyone that has any kind of medical question. They can get it the same day. And we'll do follow-ups too.
So is that because the people who came, you find out that they are not insured or they are underinsured, they don't have a primary care physician? What is it that you're finding?
We're finding that there are systems out there, but unless you hear the story that it's really hard for families when you give them an appointment and say, come back in 3 weeks. They don't know what tomorrow looks like. And when we say come back in 3 weeks for your appointment, they're thinking, well, in 3 weeks, I hope I make it in 3 weeks sometimes. So having something available on site is been a game changer for a lot of families. Having CalOptima here on site too to help people navigate insurance questions. I mean, a lot of people are signing up right here as they're getting food with CalOptima.
So I'm thinking that this is actually a perfect site when you need to do medical redetermination, right, Mr. Trent?
Yeah, it's these community sites I think that is going to be most effective in being able to connect with the people that need the help the most. Right, what we're finding out and what we're understanding is there's access challenges to individuals when they apply for benefits. What better places for us to come connect with a place that they trust, that they're able to come in and have a good conversation with individuals that can guide them to all the services that are available to them and help their families.
But even people who have, insurance, let's pick on CalOptima Health. I can because I sit in that board of director, right? And so they get assigned to a primary care physician. It doesn't mean that they necessarily show up to the primary care physician, the assigned primary care physician setting for care because of the multitude of barriers, right? Transportation, feeling like they're not part of the regular patient population that office is seeing, right? We hear a story like this all the time. And we're part of a system transformation. We started a work group, the Vaccine Task Force, that have representatives from different sectors, including the hospital system in Orange County. Perhaps this is one prime example. We should invite Mr. Lowe to talk to the system transformation people and tell them real story.
I think that's going to be an important talk and discussion to at least get hospitals, health systems, organizations on the same page of seeing what's working here and where can they help. Because it really takes a village. It takes all of us to unite our forces and all of our special gifts so that we can produce something that's even better to really serve those in need instead of staying in our siloed areas. I think that was a learned lesson throughout these last 3 years, right? Yeah. You need to get out of your silos. You need to work and partner with those around you to really be effective and make change. So if anything, COVID has taught us that.
Well, we also, especially in the mental health, for a decade now, we always talk about do whatever it takes, serve people where they at, right? Mm-hmm. Well, it doesn't mean that you do it at all, right? I can send a social worker, I can send a psychiatrist, I can send a mental health specialist, I can even send a physician to the patient's home or on the street and taking care of their medical condition. But if I'm only doing it alone and not really connected to partnership like this, you really can't do whatever it takes because it doesn't make any sense. So I think...
Yeah, and if I can add, Dr. Chow, you mentioned, I'd be remiss if I didn't mention the transportation that we provide to this location. We have local partners, My Day Counts, that has vans that they occupy but aren't busy in the mornings. And so what do? We mobilize those vans to be able to pick up seniors, to bring them here and break down that barrier that senior had to access food, or the family that they had to access the food. And again, this is part of the system. They're a partner with us, and that's how it works. Everybody chipping in, the little bit that they can to be able to help support the community at large.
Yeah, and the community have to understand that this exists, right? So I know you have an event coming up this weekend on Community Health Fair. Can you speak a little bit about that?
Yes. What it is Supervisor Sarmiento, in partnership with the Orange County Social Services, we are hosting a community resources and health fair this Saturday, March 25th from 9 a.m. to 1 p.m. It will be at Centennial Park, and our goal is to be able to reach as many of the residents there as possible. There will be language interpretation, and there will be food distribution. People are able to come. It's a kid-friendly environment, so we welcome everyone to be able to come learn more about benefits, and if they are interested, we will have workers on hand to be able to assist them with the application process. There will be diaper giveaway. Claudia will be there as well to support in providing support for our community. So I encourage everyone to participate. Again, it will be this Saturday, March 25th from 9 to 1 in Centennial Park in Santa Ana.
Thank you, An. Less than a minute, maybe 30 seconds. What's the takeaway, Claudia, for the audience?
The takeaway is we need to work together if we're going to move the needle. And what a better time to start than March, which is Nutrition Month. So happy Nutrition Month, everyone.
Mr. Perez.
I think partnerships, we're very proud of the partnerships that we have with Dwelling Place, with Second Harvest Food Bank, with our Kids Cafe program, and the Park Market program, which is also access to food, and then others, Friends of Family Pantry and Bound Care. I mean, there are so many of them. That's how we get things done together.
Lambert?
I think it's renewing our minds and understanding that ending poverty is possible. That Orange County will one day be hunger-free and poverty-free.
I've seen many heroes throughout this last 3 years of the pandemic, but you are absolutely one of those, all of you.
Yeah.
So is Antran. So there we go, publicly, you're now my hero, An.
Thank you, Dr. Chow.
But thank you so much for the three of you and folks who are involved in this, involved with the OC Hunger Alliance, and hopefully you will attract more cross-sector participants to come in, because you're right, that is a hopeful message, is that one day we can end hungers here in the richest county of the richest state of the wealthiest nation in the world. That's the promise in the making, right? So, the first week of August is Public Health Week. April, sorry, I'm moving to August already. Tell us about what's happening. And maybe the public health message is food as medicine.
Yes, food is medicine. Food has always been our medicine, and actually back to the Greek days, and I think it's really important to keep that in mind, especially as we all recover from COVID. It's so important for us to nutritionally be supported by the foods we eat, but also be supported by the communities we live in. So thank you all for your work. So yes, April 3rd through 9th is National Public Health Week, and we want to honor all of those in our, who have been really dedicated to serving our community in public health. We celebrate the week of April 3rd through 9th to honor the dedication and compassion and perseverance of our public health services team and their contributions to making our communities healthier, safer, and stronger. They're a very diverse workforce we've got nurses, doctors, lab technicians, environmental specialists who go out and really care for our communities. They're out helping homeless, they're delivering nutritional services, there's also an injury prevention teams out in the community, and they work with tobacco cessation programs, sexually transmitted infection treatment and testing teams. We have a whole public health lab, a wide range of public health clinicians. We also have communicable disease and control specialists, drowning prevention team, and environmental health workers, and so many more. All of these people work to protect and support Orange County residents and our environment. And we want to say a special thank you to all of you who have kept our community healthy and safe.
Thank you so much. Thank you for watching another episode of Your Health Matter OC. As usual, if you continue to have questions for our guest speakers tonight, please send us an email to yourhealthmatters@ochca.com. We'll see you back on April 17th. That's our next episode, and we're going to be talking about hepatitis. Until then, please stay safe, stay well, and volunteer for our food bank, Second Harvest, or volunteer to the dwelling place here. You can get in touch with them or donate. I think that's very important. Donate in. I believe in donating for a collaborative effort here in Orange County, because ultimately what we want to do is very soon end hunger in Orange County. With that, thank you to all of our guests, and thank you for the work that you do day in and day out. See you.